All right, we'll get started. Thanks everyone for joining us. I'm Ryan Terry, the Communications Manager here at the Brant County Health Unit. Here with me, I have Dr. Rebecca Comley, Acting Medical Officer of Health at BCHU, and Dr. Joanne Tober, BCHU CEO. Before we get started, can we do a quick roll call for those joining us? I'll just have you state your name and your affiliation.
Vincent Ball, Brantford Expositor.
Patty Berardi, Rogers TV.
Thank you. In a moment, I'll turn it over to Dr. Comley to make a brief statement. This will be followed by a question and answer period where questions regarding COVID-19 case trends, case and contact management, etc., can be directed at Dr. Comley, and questions regarding vaccines can be directed at Joanne. At this point, if you could put your phone on mute if you're able to, we'd appreciate it. And I'll now turn it over to Dr. Comley.
Thank you for joining us. I'd like to start by passing my condolences to the loved ones of the community members we lost recently to COVID-19. We continue to experience an increase in cases as a result of the presence of Omicron in our community. There has been growth in outbreaks in congregate settings such as hospitals, long-term care facilities, and retirement homes. Monitoring indicators like the number of outbreaks, hospitalizations, and ICU admissions are especially important when trying to understand the nature of the pandemic at this given time. The increase in outbreaks reiterates the extremely high level of transmissibility of the Omicron variant, and as we've stated previously, case numbers are no longer an accurate representation of the spread within our community. Because of the virus's high degree of transmissibility, I would encourage all residents to remember the public health basics: staying home when you're sick, even with mild symptoms, reducing your social contacts, and wearing a face covering in applicable settings. It's also critical that our community continues to receive their vaccines as soon as possible, whether it be a first, second, or third dose. Data continues to point to vaccines being effective at preventing hospitalizations and ICU stays. BCHU is working hard to ramp up vaccination efforts for our community and opportunities. We have expanded clinic capacities to offer additional time slots as we continue to offer third dose boosters for anyone 18 plus, with appointments as early as tomorrow available. This week we launched walk-in third dose opportunities for a 60 plus population with our booster blitz at select vaccination locations, and we continue to welcome walk-ins continue for those 5 years of age and older for first and second doses at all our clinics. Information regarding both scheduled and walk-in appointments can be found by visiting our website. Our public health teams are working collaboratively with our local school boards to offer booster clinics prioritizing education and daycare staff. Education staff are encouraged to reach out to their applicable school boards for information on how to book at one of these special clinics if they have not yet received this information. We anticipate the coming weeks will continue to challenge us, and we need to do everything we can to protect ourselves and our community. Through our joint individual and collective efforts, we will get through this as we have before.
Thank you, Dr. Comley. We'll now open things up for questions.
Okay, I'll go first. Dr. Comley, from what I understand, kids will be going back to school next week. Is this the right decision at this time?
I do support a return to in-class learning beginning next week. I think we've reached a point now, too, that our transmission is widespread in our community, and keeping kids at home is not going to mean they're going to be significantly less chance of getting COVID while at home. As I said before, too, I think in-person learning and education is essential for a child's development, and we should continue to prioritize this. We can also continue to use public health measures to mitigate risk, most importantly, staying at home when we're sick. We can also help to minimize severe disease through vaccination. So as we weigh all these things out, I believe it is the right move to resume in-person learning next week.
Okay, so long as people remember all the various things that they should be following in terms of public health measures, that's the key point here.
Yeah.
The other question I had was, how important is it for somebody with mild symptoms to get tested? My first reaction last week when I was reading some of the reports that were coming out is, why don't they just stay home? Is it important to get tested if you have those mild symptoms, or should you just stay home and avoid it?
Your point is well taken, that testing criteria has changed in the last couple of weeks because of the increased number of cases, and we've really focused our testing criteria on higher risk individuals. So I would say a healthy individual who has mild symptoms can stay home and isolate, as I said, and can assume they have COVID. If they have access to a rapid test, they can use it, but they do not need to confirm it with a PCR. If somebody is higher risk for complications, or if they work in a high risk setting, and there are several other factors that would make them more high risk, they would be somebody who would be eligible for testing with PCR.
Okay, so it really depends on all those other factors such as age, where you work, and if you're going to continue to work, and underlying health conditions would be among the top priorities of those people who ought to be getting tested. Otherwise, really think twice about going out and staying home.
That's right.
Okay.
And certainly there is. Okay. Sorry, I just wanted to say that there is certainly a list of eligible groups for testing, PCR testing, on the on provincial websites.
Okay. I think in your earlier comments, if I heard correctly, you said the next couple of weeks will be challenging, but you're talking in weeks, not months. Am I hearing that correctly? Do we have just a couple more weeks to get through, or do you see any kind of light at the end of the tunnel here?
I'm afraid I'm not willing to comment or to speculate on the length at this point. I think it's really tough to say at this moment how long this intense period will last. So I would say weeks in a very general sense.
Okay. Okay. Thank you.
You're welcome.
It's Patty from Rogers TV. For schools, there will no longer be reporting. Obviously, there'll be less testing. Parents are worried about that, not knowing if their children are exposed at school, because there's no condition for anybody to report that they could be identified as a close contact. What's your advice to the worried parents out there that are apprehensive about sending their kids back on Monday?
Well, I'd like to say first that the province has given us direction to transition away from that active management in schools and outbreak reporting in schools. We know this change is going to be very jarring for parents because it's quite a sudden change from December, when we were really actively managing every case in schools. As I said in the statement, Omicron has forced us to quickly transition into this new phase. So I can understand why parents are looking for answers. We need to try and move our focus from eliminating Omicron in schools to minimizing its spread in high-risk settings. And because elimination right now in our society is not realistic. And so this phase will require us to really focus on staying home when sick, just like we would if we had flu-like symptoms or another cold, isolating ourselves from other people so we don't spread it, and also isolating our household to minimize that spread. So I think that's the best guidance I would say for parents going forward. Some absenteeism may be a metric that could be used in schools to help to gauge things. And so I think that's being looked at as well as a metric going forward. But our exposure in schools and in the community is widespread. So we really just have to focus on our personal activity as eliminating that risk by staying home when sick and minimizing our social contact.
Now, I was just looking at the hospitalizations on the Brant Community Healthcare System's website. We have a lot of hospitalizations in Brant, probably the most that I can recall during any waves of the pandemic. Is there any worry here about our healthcare workers and exposure and absenteeism because of either being testing positive or being identified as a close contact? Is there any fear that we could be overwhelmed here?
Certainly all healthcare staff sectors are seeing real challenges right now with respect to absenteeism because of either contact or cases in their staff. So that's an ongoing challenge for all the healthcare sectors. With respect to the higher number of cases, there has been an increase in hospitalizations in the last week, and that is happening provincially.
Now, Foxridge has had quite the outbreak, and they have said that there have been 3 deaths that have occurred in that facility, but it's not showing up on the dashboard on the health unit's website. What happened there that there was such a widespread? Is it just because it's such an infectious variant, or were there unvaccinated residents involved?
I can't comment on the vaccination status of residents. I can say that certainly it was a widespread outbreak, and often it involved staff as well as residents, and certainly they have been very diligent in putting in their infection control practices as a result. Given the transmissibility and probably multiple community contacts, could also contributed to the widespread nature of an outbreak like that.